Dr. Lenore Coleman, President and founder of Healing Our Village and Total Lifestyle Change. Coming to you today as part of HOV Health. We're talking about Omicron versus Delta. Many of you are out there, you're confused, you don't really know the difference between the two variants. And so let's talk about the differences so that you understand that what these two variants are doing. And then also, you know, we're going to have to live with COVID-19. This SARS-CoV-2 is going to be here. And so we just have to learn how to deal with it. So let's first today talk about the difference between Omicron versus Delta. Okay. So there are currently two major variants that are affecting the people here in the United States. Now we have data from South Africa, which is where the Omicron came from, and now it is also present in the United Kingdom, in the UK. So based upon their data, we can say that Omicron is more infectious than the Delta variant. So it now represents about 73% of all cases in the United States. Now, this is why it's so critical for you to wear your mask and not be in large crowds, because the Omicron is highly infectious. Now, the symptoms from Omicron usually occurs within about 3 to 4 days, whereas the Delta replicates way slower, so therefore you don't see symptoms for about 4 to 5 days. Now remember, 30% of the people are positive for COVID-19 never get symptoms. So they can be transmitting the disease and don't know that they have it. This is why testing is important. Now, Omicron has been found to be 2.7 to 3.7 times more infectious than the Delta variant in vaccinated people. So this is why we're seeing the Omicron infection in people who have gotten their vaccines. It doesn't mean that they're going to get more hospitalizations or be sicker, but we do know that Omicron can still infect them. So that is why getting the booster, even if you're vaccinated, will help your immune response against Omicron. Everyone needs to get vaccinated. We know that the majority of people in the hospital, both adults and children, are unvaccinated. So the majority of the people who are getting sick and hospitalized due to Delta and Omicron are the unvaccinated. We also know the symptoms are a little bit different. We know that the Omicron doesn't penetrate into the lung cells, so you're not seeing as much pneumonia and severe disease. Now we know that the Omicron does not proliferate very well in the bronchi and okay, I already said that. Take that back, will you? Let me see what that says. Run that back. Yeah, keep going. Keep going. Okay, according to Dr. Fauci, keep going. Okay, so what does this thing say? Omicron variant, wait, stop right there, is less likely to invade your, now what did I say before that? Oh, okay. The Omicron variant is less likely to invade your lung tissue, which means it leads to less. Okay, keep going. You can go ahead and hit the prompter. Leads to less pneumonia and less severe disease. According to Dr. Fauci, Omicron proliferates very well in the upper airways and bronchi, but actually very poorly in the lungs, the upper airways and bronchi. So the upper airways, and I'm just going to say, and actually very poorly in the lungs. Symptoms from Delta include losing your sense of smell, a fever, a cough, chest congestion, shortness of breath, headaches, whereas the symptoms from Omicron are usually your sneezing, your runny nose, maybe a headache, sore throat, and fatigue. There's also been some anecdotal reports from doctors that they are seeing people who have what they call night sweats. So they wake up and their clothing and their sheets are wet. Now we know the symptoms from Omicron tend to be less severe than the symptoms from Delta. but Omicron can still cause hospitalization and severe cases, especially if you are unvaccinated. So we have people in the hospital right now with Omicron infections, and they're in the ICU and they're on ventilators, but they're mostly unvaccinated. So for those of you who are still out there thinking that you don't need to get vaccinated and you're just going to roll the dice and hope for the best, I am encouraging you, please, to get vaccinated. If you don't know where to go to get vaccinated, give us a call here at Total Lifestyle Change, 800-788-0941, and we will let you know where to go and get vaccinated. In fact, we're actually going to start working with a vaccination company to start providing vaccinations out here in this area on a weekly basis. We are also testing here at 177 North Main Street. We're doing both the PCR testing, which takes about 48 hours to 72 hours to come back, and we're now doing rapid testing. So we are your solution here in the Jonesboro, Clayton County area, and we're here to help. Thanks so much for tuning in. Let everyone you know to go to our YouTube channel, Healing Our Village, to be able to hear everything you need to know about COVID. You can also go to our website, tlc-global.org, and we have a COVID-19 page with videos, handouts, all types of information that you need so you can stay safe and healthy in 2022. Thank you. All right, good. All right, stop it. Okay. All right, so I'm ready. I can do this. I'm sorry. We'll knock this. We'll just do two, and so we can get you out of here. I'm sorry. I spent too much time with Cornelius.
I'm trying to get that little spot over there in that corner.
What spot? You see a spot?
Mm-hmm.
Oh, I see. I can totally. I guess I can see. I don't know what spot.
It's like right. See everybody. You see in the corner on the right side? How the
Oh, yeah, I see your hand. Yeah.
shit on there.
Oh, you know what I need to do? I need to have Scott redo this drawing. And you know that HOV?
Mm-hmm.
He needs to bring it up. So it's right, so you can see it. So it's not behind me.
Right.
I'll have him work on that and fix that for me. Have it in the middle. I love this background though. It's my favorite. Oh, she's probably your wife. Tell her we're almost
Let me
done.
call you back. We started recording. Okay. Bye-bye.
I promise we'll get you out of here. Just knock these two out.
5, 4, 3, 2.
Hi, I'm Dr. Lenore Coleman, president and founder of Total Lifestyle Change and Healing Our Village, coming to you today with For Your Health. As you know, we are really focused on COVID-19 and trying to tamp down all the misinformation. We are now doing testing here at our Jonesboro location at 177 North Main Street in Jonesboro. And because of all the testing that we're doing, we know that a lot of people are still very confused about the different variants that are here in the United States. So the difference between the original COVID-19, SARS-CoV-2, and then the two variants, which are Omicron and Delta. So we had the original that happened in 2020. Then in 2021, we got the Delta, and then toward the end of the year, we got the Omicron variant. So let's talk about the difference between the two, because it's very important for you to understand the difference. So currently, there are two major variants here in the United States. Our knowledge of these variants come from data from the South Africa, from the UK, and from other parts of the world. We know that in South Africa is where they first discovered the Omicron variant. Now we know that Omicron is more infectious than the Delta variant, and it now represents about 73% of all cases in the United States. That's why it's so important for you to wear your mask and to not be in large crowds. Now the symptoms from Omicron, they occur within about 3 to 4 days. And then the symptoms from Delta, because it replicates slower, takes about 4 to 5 days before you to become symptomatic. Remember, 30% of the people are positive for COVID-19 and never have symptoms. So just because you're feeling fine does not mean that you might not have COVID. Omicron is about 2.7 to 3.7 times more infectious than the Delta variant. This is why we're seeing so much more Omicron, even in people who have had their vaccinations. Now, we know that getting a booster will help your vaccinations work better. It helps to boost your immune system, especially against Omicron, where we found the vaccines don't work as well as they worked against Delta. Now, we know that most of the people that are in hospitals right now, greater than 90% of the adults and children in the hospital are unvaccinated, and they have this Omicron variant. Now we know that the Omicron is less likely to invade the lung tissue, so we're seeing less pneumonia and less severe disease with Omicron. In fact, Dr. Fauci says that Omicron proliferates very well in the upper airways and very poorly in the lungs. Now, the symptoms of Delta include losing your sense of smell, the cough, the chest congestion, the shortness of breath, and maybe a headache. Symptoms of the Omicron are the runny nose, the sneezing, maybe a headache, sore throat, and a lot of fatigue. Some doctors have also said that their patients are having night sweats, and so they wake up with their sheets and their clothing soaked. The symptoms of Omicron are less severe than those of Delta. But Omicron can still cause hospitalizations and severe cases in both children and adults, especially if they are unvaccinated. So it is so important for your children to get vaccinated. You know, the vaccines now go down to 5 years old. So you need to get your entire household vaccinated. You need to get your boosters. You don't have to wait any longer. Now you can get boosters. Most people are eligible for a booster so that we can fight against the Omicron, which is very, very infectious. You know, during the holidays, during that Christmas and New Year's, we had 100 people coming through our shop here in Jonesboro daily. Our numbers have dropped off dramatically. Everybody thinks that, you know, everything's fine, but that's not true. Grady Hospital has already got beds full. They've had to bring in the National Guard because all of the healthcare professionals are now coming down with Omicron and are testing positives. So all of our hospitals here in Georgia are being affected by the fact that we here in Georgia are not vaccinated. It is so important that we get our numbers up to 80%, 90% vaccinated. We're still down in the mid 40s, the 50s. So please, out there, it is so critical that if you're having symptoms, you get tested. If you've been exposed to someone, whether you have symptoms or not, if you've been exposed, you need to get tested because we do not want to continue to spread this Omicron variant throughout our cities here in Georgia. If you have questions about this, please give us a call at 800-788-0941. We're doing both the PCR testing and rapid testing here at our Total Lifestyle Change at 177 North Main Street, Jonesboro, Georgia. Come on over. We're here Monday through Saturday and we're testing. So give us a call. Come get tested and let's stamp down this virus here in the state of Georgia. Thank you so much for tuning in. Total Lifestyle Change provides community-based outreach, education, and comprehensive health screenings. Unlike other organizations, TLC provides ongoing follow-up and documentation of clinical outcomes. This much-needed follow-up ensures that participants with abnormal test results receive the much-needed care that they deserve. TLC provides exit interviews with licensed healthcare providers to evaluate screening results and review medication therapy. We have opened the Wellness Connections Elder Care and Diabetes Management Center located in Jonesboro, Georgia. Our address is 177 North Main Street. At the Wellness Center, we provide diabetes classes, home health care services, nutritional workshops, and even cooking demonstrations. TLC needs your generous support to bring our outreach program to your community. Your generous support makes it possible for Total Lifestyle Change to provide our educational workshops, our health fairs, our cooking demonstrations, and our church-based program to underserved communities nationwide. To donate to TLC, go to tlc-global.org. Please consider making a tax-deductible donation today in any amount that you would like. For more information, contact Dr. Lenore Coleman, President and Founder of Total Lifestyle Change, at drcoleman@healingourvillage.com. Thank you so much.